So I'm going to be talking about workplace health and wellbeing programs and kind of a strategic approach which is more sustainable, more sticky if you like. In terms of where we're going from here, oops, is that the right one? I think we start off by saying, well, why would you do workplace health and wellbeing? And a lot of people do start with the business case, which is there. I think most of us on this call or in this room would probably agree with the evidence base that you come across managers who do not, you come across some academics who do not, but we do know that there's a large evidence base here. So I've cited my colleagues from RAND there, but it's like your work, you know, there's all sorts of stuff out there as well. And some of the things, the RAND work is quite interesting because they're dealing with costs of absenteeism, presenteeism. What isn't in there are the costs of reduced innovation in some industries that rely on heavy creativity, like especially high value added industries around design engineering, the costs that may be associated with workplace accidents because people are a bit anxious, and we know negative effect has an impact on safety behaviour as well. So there's a business case, we know that. Okay, so let's not go into that. In the UK there is a legal case, and most developed economies there is a legal case, of course. 1994 was a landmark judgment. I'll go into the detail about that, but the judgment basically said there's no difference in law between injury caused to psychiatric health than injury to physical health as well. So before that, the interpretation of the 1974 Health and Safety at Work Act had been you have to lose a finger or something like that. So psychiatric injury, as defined there in that particular case, came in more or less at the same time. And I know you guys have an interest in policy, more at the same time as the EU was developing thinking around job quality and mental health. So for the British, there was a confluence which helped things there. And the other thing related to policy as well is there's the economic cost to society. And you know, as we know, Departments of Work and Pension spend is huge on working age disabilities. So the more you can get people into work, and mental health can be a barrier. Poor well-being is related to less pain tolerance, reporting higher pain. So for someone like me who suffers from a little bit of back pain, if I'm feeling worried, it gets worse. If you're happy, it gets better. So it's going to have an impact both through physical symptom experience as well as mental health symptoms as well. So there's all sorts of reasons why we should be interested in workplace health and well-being beyond it's scientifically interesting as well. So before we go on, I'm not going to go through everybody. So all that work is basically, I'm not going to try and summarise it all, but these are the people that we've worked with over the years. Starting a collaboration between East Anglia and Essex, and then people just kind of exploded and went in other places as well. So before I go into the actual substantive bit of what I'm going to be talking about, the gap that we ended up looking at, and this was the language is co-produced, co-defined, if you like. We were essentially asked to look at this by our sponsors and by the organisations that we work with. So we weren't getting organisations coming to us. Our sponsors are essentially Department of Work and Pensions, and a little bit of what was BAYS is now Business and Trade, but essentially Department of Work and Pensions through the Work Centre for Wellbeing and some subsequent work as well. And employers, so they weren't asking us what works. What they were saying to us, we don't know how to make it work. How do we make it work? And that led us away from thinking about evaluation of initiatives, more to looking at, well, what kind of organisations do initiatives stick, and what kind of organisations do initiatives work? Because there is variability there. So although in the area of occupational health and wellbeing there isn't a lot compared with public health and wellbeing in terms of interventions and evaluation of complex interventions, the relatively simple interventions are relatively well researched. to the more complex strategic things. And what we were finding when we were talking to organisations, there were some organisations that, certainly British Telecom is a very, very good example. BP is another example, interestingly, with two very influential and charismatic chief medical officers there as well. But you can come across Adnams near us, the brewers. They're another good example. Organisations that have been doing things around wellbeing for a long time and have a lot of capability and a lot of knowledge. And some organisations that were a bit more, well, we'll try free fruit, or we'll try mindfulness or something, and a bit, less sophisticated, less mature in their approach. And what we came to the conclusion was we needed to look beyond the usual evaluating interventions and to look at a more kind of cultural thing. Now, for me, this is quite easy because I often describe myself as a box standard health and safety psychologist. And if you know anything about psychology of workplace safety, the big concept there is safety culture or safety climate. So we started thinking, well, we can start using some of the concepts from that area, as well as a more kind of organisational development area as well, organisational change area, and start looking at it through that lens, rather than through a intervention, kind of public health, occupational health lens as well. So that's where we went. So the basis of what I'm going to be talking about is multiple systematic reviews. I'm going to draw heavily on one, which we published in Social Science and Medicine a few years ago, and two empirical studies, qualitative studies, which are essentially case studies based. One of those we're still working on, where we collected data, longitudinal qualitative data through the pandemic, through 8 case organisations, which was very instructive. Because in those 12 months, of course, health and wellbeing programmes evolved at a massive scale because of what was going on as well. So that enabled us to look at change that we'd normally probably have to wait 7 years to work through as well. Okay, so what do the progressive organisations do? What's a more kind of sustainable strategic approach? Well, we find 5 ways to organisational wellbeing. As you will know, the magic number is 5 when it comes to wellbeing. So as well. So we tend to see the more progressive organisations don't look for a silver bullet. They don't look for Fruity Fridays or whatever, or offering exercise classes. That they do a statutory responsibility in terms of management, working conditions, terms and conditions, and those kind of things, which we call good management, good relationships, and high quality jobs. That is a statutory requirement through EDI legislation or flexible working legislation, and health and safety legislation as well. That organisations don't do it might tell you something about the level of enforcement, not what the legislation says should be happening. And of course, that's going to, with the current Labour government, we're going to move more in that direction with the Employment Rights Bill as well. So you have that, and then you have the things around, we call it help for those who are struggling, so this is something we use so we can communicate with employers, and that's things around rehab, return to work, stay at work, those kind of things, reasonable workplace accommodations and adjustments for those with all sorts of health conditions. And then that, for wellbeing awareness, that's your workplace health promotion. That's the kind of intervention I kind of get a little bit annoyed with, because I don't like being told to eat less cake. I like eating cake. And it's those kind of interventions. Most organisations start off on the let's do the health promotion. They really should start off on the let's get the jobs right. Because jobs, high quality jobs and relationships at work are the big determinants of workplace health and wellbeing. So that's what's in the approach. And this is subsumed under regulatory requirements. Multiple systematic reviews of the components indicate these things can work. I'll stress that can. We'll come back to that can conditional in a second. There's often, and I know Carol Black gets really annoyed about this, that there isn't an evidence base for some of these things, there isn't a theoretical base, but you can find interventions out there. I mean, mindfulness is a good example. There's a robust empirical and theoretical base for those kind of interventions. So they should work. They should work. Borrowing concepts from public health, that subsumes the primary, secondary and tertiary, which is good practice. Interventions, often Organisations will build in continuous improvement, so they change their programme. Again, that's in the guidance. That's in things like NICE, things like the World Health Organisation, the ISO standard on health and safety, and what will be, if it ever comes, the standard on workplace wellbeing as well. So there's all sorts of reasons why you should be doing this kind of strategic approach with multiple activities with a continuous improvement process. Organisations don't, and sometimes interventions don't work. In fact, if you look at some kinds of the job design literature, it seems to indicate that roughly 50% of interventions don't have an effect, but 50% do. But even for more simple ones, you can find examples where mindfulness instruction, which is relatively, you can do it on an app, it's relatively simple. There are RCTs that show the apps work, but don't work in occupational organisational context. So the question is why? There are some instances in the literature of adverse effects, so things actually making well-being worse. There are some statistical sort of measurement potential explanations. I'll not go into those, but we can discuss that later. For psychometric nerds like me, it's great, but for other people, it isn't. But the frequent culprit is implementation. The thing didn't work because it wasn't managed properly. So there is a literature out there on implementation, and so we decided to look at that in a lot more detail and supplement that with the qualitative evidence. So fill in gaps where the literature isn't as strong as it should be, and there are areas where the literature is not as strong as it should be. Okay, so can these things work? Yes, and there is a yes but or a yes if. The thing has to be implemented, and then, I mean, this is obvious in a sense, something has to be activated. So you have to have both, use mindfulness as an example, both access to the mindfulness instruction, the app in the workplace, and there has to be an improvement in mindfulness. So that's how it should work. So you need both of those things to happen. Other things can get in the way. And what we found in both the literature, is more obvious in our case study research, was you got some what we called emergent mechanisms, things that you might call it placebo effect. Organisational theorists might call it, scientists might call it a Hawthorne effect, but something that wasn't intended but has a benefit. We found these were almost always around social interaction, so go back to mindfulness. If you have mindfulness workshops, the mindfulness instruction might work because you get people together. And that's one of the simplest things you can do in a workplace to promote well-being. So you're all going to the pub later. So this is a good thing from a well-being perspective because you encourage social interaction. It's a really simple thing. And that tends to work, as things can get in the way. Or you can find stuff around improving health norms. So, people say, well, and we did this in our evaluation of the mindfulness intervention in the police. What we did find was some people saying, well, I didn't really engage with mindfulness, but it did encourage me to, go out for a run. Sort of look after myself a bit more. So it changes norms around health and well-being as well. We didn't find any evidence of anti-mechanisms here. This is why the adverse effects were. They weren't evident in the literature, not evidence in our case study research that we found so far, but they are theoretically possible. I've noted two papers there, one which looks at implementation of new human resources practices in an aerospace manufacturer. That's a Danford paper. They don't report any wellbeing outcomes, but they do report a lot of employee cynicism because of a history of poor industrial relations in that particular plant. Now, they were meant to be implementing new human resource management practices that are supposed to improve wellbeing around more skill variety, more autonomy, those kind of things. But and cynicism was also reported in the Dragaskas out paper. That did actually show benefits on job satisfaction. That was a safety intervention that also showed benefits for safety, so it's not surprising that people were happier because people weren't having as many accidents. in a high hazard industrial environment as well. So we think they must exist, but we haven't found out what they are there yet. But you know, there might be an artifact of just being unlucky that something happened in the treatment group, but not in the control group. We don't know. The interesting thing, though, we found in the literature and in our case study research is a lot of the implementation literature will say things like, oh, you've got to have your middle managers, you know, on site. Middle managers can be obstructive, and that's the same with change management literature in general. You've got to get your middle managers on site. Now, middle managers might be sceptical, they might be cynical, they might even be overtly hostile. Organisations can get middle managers on site. One of the easiest ways we come across in our research is to make the health and wellbeing of the people you manage a performance requirement. So there's one organisation. I remember, I know the guy who's interviewing quite well because he works in a high hazard context. He's participated in a few of the studies we've done on safety. And he said, well, you know, we've put sort of health and wellbeing in as a performance expectation. It's not a requirement, it's an expectation. What's the difference? You know, kind of thing. I suppose one is you might get the sack, as you would do, you know, if you know, there was unsafe working practices. Similarly with workers being hostile, can be overcome with effort. If you've got a service or a service delivery mechanism, like the person who's doing the mindfulness instruction, people don't like, well, you can change that, you can adapt that as well. There are instances in the literature of occupational health and human resources falling out, sort of political activity, that can be overcome as well. People seem to like novel interventions. Again, that can be overcome. You do some adaptation. A lot of people say, well, you know, the big killer will be organisational changes, mergers, those kind of things. Yeah, we do see evidence of them getting in the way, but we also find evidence that it can be overcome. And if you look at the pandemic, of course, that's a really good example where a very adverse economic context, as well as a health context, indicated that some organisations, not all organisations, some organisations were able to get over that, including in one of our cases, an organisation where they had a cynical workforce and they had a facilities management organisation. They had to be on site. If you're doing facilities management for a food manufacturer, which they were, you have to be on site. You can't do that at home. But they managed to do quite well, given their starting space, as it were. There is evidence, of course, that you have to do it authentically. We found this from our research, and it's, again, not surprising. I suppose what evidences authenticity is a continual process of listening to your workers, listening to your employees, and adjusting what you're doing around wellbeing, and not just saying, well, there you go, we did Fruity Friday last month, that's it. It is an ongoing process, so there's a continuity and continual adjustment as well. So a programme of activities, so you demonstrated you're committed as an employer. But we did find these critical success factors. This is the one when I'm talking to employers, you kind of go, well, this should be self-evident. Just persist and adapt. That's, there is no sort of magic bullet here. There is no hidden sort of logic or mystery to it. Just persist. And if you're committed, you will persist. But you need to adapt. You need to have the learning mechanisms to adapt. So if you don't adapt what you're doing, it could fall over together. So you do need the learning mechanisms. That requires regular communication. Communication is really important as well in terms of bringing things together. So we come across organisations where they said, well, we were doing this over here around equality, diversity and inclusion, and we were doing some facility stuff around here about sort of physical working spaces, and we're doing stuff about return to work. So what we decided to do was, when we were sort of communicating about wellbeing, so well, that's got a wellbeing outcome, and that's got a wellbeing outcome, and that's got a wellbeing outcome. So we're just sort of, we could bring this together and say, this is what we're doing around wellbeing. So we're not just, saying, if you're feeling stressed, go to our employee assistance program. We say, actually, we're doing quite a few things around here as well. So it boosts the signal. And that signal does indicate a level of care. One of the other things we found was it's really, again, you might expect an organisation or a scientist to say, well, actually you need to manage this thing quite well. And you do need that governance, those governance structures as well. These need to be inclusive, have the right level of stakeholders, including employee representation as well. One of the functions of the governance structures are around planning, resource allocation, resource acquisition, communication, those kind of things. But there's also a lot we found that is a lot more related to cultural and political factors in organisations. So we did come across organisations saying, well, we knew that manager, senior manager, would be quite sticky about this. So we co-opted that person onto the steering committee, which is, that is overtly political co-optation. And there are cultural factors around signalling as well. So, if you've got your senior managers on the steering committee, that's clearly a signal as well. Similarly, like having resources and time to do these things is both a kind of rational thing to do, if you like, an instrumental thing to do, but it's also signalling that there is a resource here as well. Now, what I would say is that thing around governance, we drew a lot from our case study research there. There's not much in the evaluation literature around those things. That might reflect the disciplinary backgrounds of the people doing the evaluation. And, it's kind of, we don't do organisational stuff, so we kind of ignore it, that kind of thing happens. It does appear that senior managers can be mission critical, so they can withdraw support, but we have evidence from our case studies that not necessarily in the beginning. So have you heard of the term skunk works in innovation? It's where you got your pet innovation. It was found with software developers. You got your pet innovation projects, but your employer won't let you work on that. So you keep it hidden away. It's called skunk work. So you're like, yeah, I'm doing the software development you're asking me to do, and then secretly you're doing something else. And there's some evidence that these things are actually beneficial for organisations as well as keeping software developers interested. So we do find evidence in our cases of these kind of skunk works where people start wellbeing activities and then they kind of build up and then they get to a certain level and say, well, we can't hide this anymore. So we have to involve the senior managers as well. And there's some evidence of that in the literature we also found in our case studies. But one of the things that we did find relates to senior managers, and we nicked this idea straight from strategic management. So if any of you have done any strategic management, it's Fralahad and Bettis, the dominant logic in an organisation. So what's the organisation about? So basically what do people internalise as the business model for the organisation, the purpose of the organisation. What we found in our sort of empirical research, our case study research, was organisations did develop a wellbeing logic. And it's effectively either an explicit or implicit business case. So this is not a return on investment calculation. That's great. I know there's a lot of economists in the room, a lot of economists listening. Brilliant, it's great stuff. Carry on doing it, please. Because I can't, I'm a psychologist, so I don't value anything. But what we did find, yes, there has to be a return on investment. So you're not going to get past your organisational decision makers if you cannot make the case as a return on investment. That might be quite flimsy, not proper econometric analysis or that kind of thing. It might be quite flimsy, but you have to demonstrate a return on investment. But what we did find was more that the case was made on the basis of a strategic need of the organisation. Often this was around recruitment or retention. I do remember talking to one senior manager who was saying we were looking as an infrastructure firm and we were saying, well, why did 20% of our projects not come in on price? Essentially, why do we fail 20% of the time? And we started asking ourselves questions about that and we thought, actually, that's how we treat people. They're leaving before the end of the project, so we need to recruit the best people and retain them till the end of the project. And how do we do that? Well, we look at wellbeing. So although a lot of the calculations are around absence, or more rarely presenteeism as well, mainly around absence, it's not seen as a business. I've not come across an organisation who say, well, we have a really bad absence rate. we've got to do something about it. It's kind of like, oh, it's the cost of doing business, an absence rate. It's like in call centres, or in business schools, you kind of say there's a high turnover. It's one of those things, isn't it? It's the cost of doing business in that area. But the other thing we found was that this kind of well-being case, this wellbeing logic, is remade and evolves. Partly because the organisational circumstances change. The organisations are in flux all the time, but also because the counter logics, there are counter logics here as well. I should say we have come across a couple of organisations where we just said we don't want to run our business like other people in the sector because it's far too stressful. We didn't like working for them. We just want to be a nice place to work. That's kind of organisational would be less explicitly cultural. Usually it's more, there is an instrumental case. So we did come across competing logics as well, and these will be around other priorities, or we can get performance outcomes in a much more straightforward way in accountancy practices. Well, it's the end of the tax year. Of course we've got to work silly hours. That's our business model. So there's things like that. And we found during the pandemic, actually, as well as evidence from other sources, that if there's disruption, so you can have your wellbeing logic, it can be stronger than a competing logic about how you get productivity gains. But if there's disruption, those other priorities come up, those other logics come up as well. And we have found evidence, not just during the pandemic, but before that as well, in our case study research, that we seem to come back. And so the quotes there, so this was an interview one of our team did in 2019. So that's with the head of HR who implemented Health and Wellbeing Programme. So it's just basically in 2016, I said to the partners of this accounting firm, basically you've got an awful turnover rate, do something about it. Wellbeing's a way of doing it. So we were educating interviewing the managing partner in 2019. He's still saying, we're still having that argument. Even though in this particular organisation, you had, well, they've won prizes for their wellbeing programme. Their turnover rates dramatically reduced. When we did interviews and talking to the workers, the trainee accountants, and we got really, really good feedback from them about that organisation as well. I know that doesn't count as scientific proof, but it does in some way indicate that even the successful organisations are having these fights all the time. Okay, so I'll leave it there, shall I?
Yes, please. Thank you, Kevin. Mark.